We talk with Dr. Jessica Saepoff about the pros and cons of today's dental materials and how they've evolved over the years.
There were, 150 years ago, few choices for dental fillings. One was gold, and it was very expensive, and only people who had a lot of money could get their teeth fixed with that. And a new material that I think came from France, I don't know the exact history, that was a mixture of 4 powdered metals plus mercury, liquid mercury. And they would mix it together into a paste, and they called that amalgam, which is the word for any mixture of things, really. And dental amalgam is made of 5 metals, one of which is mercury. Mercury is about 50% of the material. They would put that into the cavities, and it would harden up, and it would work. The teeth did okay, it stayed there, it was inexpensive, and that was wonderful, so a lot more people could get dentistry, and they just didn't have any other alternatives at that time. Nowadays we have alternatives to that material that don't have those metals in there, but you know, it turns out that the metals are pretty well mixed, and for a long time it was thought that the mercury stayed in the filling and didn't come out of the filling. It turns out that it does off-gas very, very tiny, tiny little bits of mercury all the time. It's a very small amount, and the American Dental Association says that it isn't enough to cause any health problems, but there isn't universal agreement about that. And in 4 states in this country, dentists are mandated by law to give patients information sheets that have the ingredients of the various filling materials. And people need full information about all of the ingredients in the fillings in case there's something they'd rather not have in their mouth, especially if there's another material available that seems not to have an ingredient like that seems like it might not be a good idea to put it in the mouth. There are other materials that are in dental materials, like there's nickel in a lot of dental materials, especially orthodontic materials, and there is beryllium and other metals, cadmium, and in other like root filling materials, and crowns are made with, you know, a mixture of metals that they call it an alloy, and then they put ceramic on the top of that. Well, nowadays you can get solid ceramic crowns, and they are always improving them. They're virtually unbreakable, some of the varieties of ceramic, which was a concern in the past, but really isn't any longer if you select your materials correctly for the right teeth, right part of the mouth. And you know, there are alternatives now. In my office, I mean, my philosophy is if a material comes to me and on that are contraindications or warnings from the manufacturer, I believe in letting the patients know. I believe in passing that information along to the third-party user, it's called. In the pharmaceutical industry, when you go to the drugstore and you get your prescription filled, the pharmacist must tell you by law all the warnings that come from the manufacturer of that medicine. And I think that, you know, for me, the same is true in dentistry. Even though we are not required to do that, I feel obligated to let people know. And I don't want it to be used to scare someone into getting, you know, a material or getting a dental procedure. That would be not okay, ethically. But it's important for people to be able to make those choices. Now, for people who already have these materials in their mouth, it is a very just tiny amount that comes out, and you need to just do your research and find out what the risks and benefits are of keeping the material in or replacing it, and then make up your own mind. I like people to learn to follow their own gut instincts on it, and then to seek the care that makes sense for them. And it's also good to find somebody, if you are having it removed, you're going to want somebody that's going to be very careful during the removal of any metals, not just the materials that contain mercury or nickel, but any metals, because while it's being drilled out, there's the possibility of breathing some of that dust or vapor or swallowing some of that dust. And so there are some recommended protocols that some of the holistic dental organizations have taught their members, so that when it's removed, it's done in a way that prevents the patient from breathing or swallowing any of that, and also keeps the office air clean, which is important for all of us.